The posture that we want to talk about is a sway back posture. Your back is under stress all the time. You are not activating glute as much as you should, and you kind of hanging there.
Okay, let's go.
Hello everyone, welcome to my channel. My name is Dr. Shiva Aslanpour, and today I would like to talk about one of the most common postures that I see among majority of people, especially younger generations, and it concerns me. The posture that we want to talk about is a sway back posture, which means you are hanging off your hip like this. When you have a habit of staying in this position, your back is under stress all the time. Knees are semi-bent, and also the majority of the weight is transferred toward the toes. So instead of standing on the heel, which is this, you are transferring your weight mostly toward the toes, and your knees have to follow. Your butt gets more flat, your glutes get pulled out, they are getting overstretched, your back muscles are overstretched. You are not using your glute muscles. You are not activating glute as much as you should, and you kind of hanging there instead of using muscle. That's how you're trying to stand, which lowers the stability of your pelvic floor. We know pelvic floor is really important to stabilize our core and protect us. So one way to improve this is body awareness, which means being aware of how you are standing. You can record yourself while standing from behind and from the side to have a better visual feedback. You can ask one of your family members or friend help you to observe your posture, give you more feedback about how you're standing. And then I want you to start correcting yourself. Posture is something habitual. So you need to keep reminding yourself. You need to introducing new way of standing and moving to your brain and keep repeating that pattern until it turns to something habitual and it goes to your subconscious, so you don't need to be worried about it. When you start observing your posture, you keep catching yourself in a certain way. That's the way your body is compensating. And it might be the reason that you never recover from back pain. You keep having that old nagging pain that's stopping you from doing the things that you like, or it even impacting quality of your work. It can impact your sleeping quality. The best way to improve your posture is learning how to reposition your body. And you always should start from putting your pelvis in a better position. For example, in standing, instead of keeping both feet next to each other, start putting one foot in the front and one in the back. Right now, my left is in the behind and the right is in the front. I keep the right knee a little bit loose. My whole weight, like 70% of it, is felt over the left leg. In order to feel something in the front leg and avoid falling from the back, I start pressing the big toe down in the front, so I feel the arch in the front leg. That will transfer center of gravity between 2 feet, and it will help me to engage my core muscles. This is a better position for your pelvis. You cannot arch your back, you cannot tilt your pelvis anteriorly in this position. So you are starting putting your muscles in the right angle so they can function easier. One of the problems with sway back posture is that your glutes don't get a chance to get engaged because of how you're standing. Now we want to engage glute muscles. How? Start bringing the front hip forward a little bit until you feel that on the left side, your outer hip muscles are getting engaged. So you just keep twisting it without rotating your shoulder. On the right side, I push the big toe down a little. I feel my arch, and I keep my right knee above my toes. I don't let it go in. I keep it on top of my foot. That will help me to feel more glute muscles on the right side also. I hold the position. What I'm feeling is inner thigh muscle on the left and outer hip. Also, I feel glute muscle on the right side. I would like to engage more abs to stay more stable while standing. So I drop the shoulder on the left side a little bit. So it's not a side bend, I'm just dropping it. I'm just depressing the shoulder down. That will help me to feel my oblique abdominal on the left side. Then I start bringing the left shoulder to the front. So the right hip and left shoulder come forward, like I'm twisting. I will hold the left arm in the front and the right arm behind and stay in this position. I try to breathe in and out. After a couple of breathing, this time I stay on the right side and repeat the same thing. The left is in the front. So I press the big toe down. I try to hold my knee above the toe. I bring the left pelvis more front. I depress the right shoulder and I hold the position. So as you see, shoulder, hip, and ankle on the back leg should stay aligned. And I'm just trying to bring this shoulder to the front and a little bit down. Don't forget to bring your attention toward your breathing while standing correctly, because breathing normalizes things and it will teach your brain that it's okay to hold this posture, because when we are doing things in a certain way, the brain accepts it as a norm. And when we want to change it, we always feel resistance. We always feel that the body doesn't want to move that way. It's strange. So when you start practicing that movement and add a breathing component to it, you are telling your brain that I can breathe and stay in this position and nothing will happen to me. It's not a big deal. Try this at your work, when you're doing your house chores, while you're standing outside for someone. And there are lots of tips about standing that I would like to teach you. This was the first video I made. I hope you enjoy it. Don't forget to subscribe in my channel and I see you next time.